What is the historical context of clinical diagnostic tools? Have you ever wondered how the tools that doctors use today came to be? The history of clinical diagnostic tools is a fascinating journey that reflects the evolution of medicine itself. In ancient times, medical diagnosis relied heavily on what patients reported and the subjective judgment of physicians. This meant that much of the diagnosis was based on personal observations and narratives. Fast forward to the mid-19th century, and we see a significant shift. The introduction of instruments like the stethoscope, ophthalmoscope, and laryngoscope began to change how physicians examine patients. These tools allowed for a more objective examination of the body, moving away from just listening to patient stories. Physicians could now hear heartbeats and lung sounds, or look into the eyes and throat with greater clarity. As we entered the late 19th and early 20th centuries, the landscape of diagnostic tools expanded even further. The invention of the microscope and X-ray revolutionized how doctors could see inside the body. Chemical and bacteriological tests became standard, allowing for a more scientific approach to diagnosis. For instance, urine analysis became a common practice, with tests that could detect substances like glucose, linking them to conditions such as diabetes. The introduction of centrifuges made blood analysis more precise, while advancements in immunology and microbiology provided new ways to detect infections. This period marked a transition where some diagnostic processes moved away from the patient. Specimens could be analyzed in laboratories, sometimes by specialists who were not directly involved in patient care. This change required a formal organization of medical practice around laboratories, leading to the establishment of clinical laboratories as essential components of hospitals by the early 20th century. Throughout the 20th century, laboratory techniques continued to evolve. Innovations like radioactive isotopes and advanced imaging methods, such as tomography, enhanced our understanding of how diseases function. These tools improved the accuracy of diagnoses and broadened the scope of what could be detected. For medical students today, understanding the historical context of these diagnostic tools is vital. It highlights the importance of combining traditional physical examination skills with modern laboratory techniques. During clinical rotations, students learn to interpret both subjective clinical skills and objective data. This dual approach is essential for forming accurate diagnoses and treatment plans. As technology in medicine continues to advance, the need for continuous learning becomes clear. The history of clinical diagnostic tools not only informs current practices but also prepares future physicians for the ever-changing landscape of medical diagnostics. By appreciating this history, students can maximize their clinical learning and ultimately improve patient care.